Hello and welcome to today's event. My name is Caroline Legros, and it's a privilege and honor for me to represent WFP at today's session on delivering together integrated school health and nutrition approaches for education in emergencies and protracted crises. WFP is organizing this session in collaboration with Finland, France, Education Cannot Wait, and UNICEF. And we're really excited to contribute to the European Humanitarian Forum by holding this panel discussion. And what a great lineup of speakers we have for you today. It's really exciting, more to come, but we have the Minister of Development Cooperation from Finland, we have the Minister of Education from Yemen, the Ambassador of France, and senior experts from World Vision and UNICEF joining us today. And we have only 1 hour, but a very busy agenda. So the session really has 3 key objectives. We want to promote dialogue about the safety, education, and well-being of school-aged children, especially girls and vulnerable children in crisis-affected countries. We want to provide concrete examples of joint action between humanitarian actors, tackling education and hunger together. And we want to identify what are the actions needed to expand support and financing to reach those that need it the most. So we have a busy, ambitious agenda, but before diving in, just a few small housekeeping points. Please do keep your microphones on mute to prevent background noise. This session is being simultaneously translated into French and Arabic, and you can choose the language of your liking at the little world icon on the left. Time permitting, we will have a short Q&A session at the end. So please, as we're going along, feel free to put your questions in the chat. Now, without further ado, let's get started. I would like to pass the floor to Mr. Ville Skinnari, Minister for Development Cooperation and Foreign Trade of Finland. Finland is one of the 2 leading countries of the Global School Meals Coalition, and Minister Skinnari himself is one of its biggest champions. Minister Skinnari, the floor is yours. It seems we're having some technical difficulties. Apologies for that. Technical team, can we play the statement from the minister? Apologies for these technical difficulties. Here we are. We seem to be having some technical difficulties. Apologies for that. While that's being sorted out, let me please pass the floor to the Ambassador of France, who is also a key supporter of the School Meals Coalition. It's a pleasure and honor to welcome Ambassador Celine Jurgensen to give opening remarks. Over to you, Ambassador.
Merci beaucoup et je remercie les équipes du PAM pour l'organisation de cet événement au Forum humanitaire européen. C'est un honneur pour moi d'être ici avec vous et la diversité des acteurs présents aujourd'hui montre à quel point l'alimentation scolaire est un sujet multidimensionnel. C'est une triste réalité et la situation en Ukraine en est une nouvelle illustration tragique. L'éducation des enfants est l'une des premières victimes des crises et des conflits. D'après l'UNESCO, ce sont aujourd'hui près de 6 millions d'élèves ukrainiens âgés de 3 à 17 ans qui sont aujourd'hui touchés par la fermeture des écoles causée par l'agression injustifiée et injustifiable de la Russie. L'éducation est également sacrifiée du fait du terrorisme. Je pense par exemple au Sahel, où les États, aujourd'hui victimes de terrorisme, sont contraints de fermer des milliers d'écoles, privant les enfants, en particulier les jeunes filles, de l'accès au savoir. Lorsqu'une école ferme, ce n'est pas seulement l'apprentissage des enfants qui est mis en péril, mais aussi l'accès à des services de santé, d'alimentation et de nutrition essentiels. Et nous avons tous pu le constater avec la pandémie de Covid-19. Cette crise a non seulement créé l'une des plus importantes perturbations des systèmes éducatifs de notre histoire, mais elle a également provoqué la mise à l'arrêt des programmes d'alimentation scolaire. 370 millions d'enfants ont ainsi été privés de leur unique repas de la journée. Les actions de la France visent avant tout à soutenir les efforts pour permettre l'accès à une éducation de qualité pour tous et toutes, quel que soit le contexte, en renforçant l'articulation des interventions en situation d'urgence et de développement. La France contribue notamment à financer l'aide d'urgence en matière d'éducation, que ce soit via le partenariat mondial pour l'éducation, pour les pays en situation de crise et d'urgence, via Education Cannot Wait ou encore via l'action extérieure de l'Union européenne, dont le pilier d'aide humanitaire à l'éducation atteint désormais 1,6 milliard d'euros. Pour répondre à tous ces défis, nous devons agir collectivement dans les espaces et dans les secteurs qui en ont le plus besoin, en particulier les zones touchées par les crises, tout en nous donnant les moyens financiers de notre ambition. C'est dans cet esprit que la France a donné un nouvel élan à sa politique de développement, qui est l'un des piliers de sa politique étrangère. La loi de programmation relative au développement solidaire et à la lutte contre les inégalités mondiales, promulguée en août 2021, dote la France de moyens accrus pour investir dans la préservation des biens publics mondiaux. Elle met en œuvre l'engagement du président de la République d'atteindre 0,55% du revenu national brut consacré à l'aide publique au développement en 2022. Il ne s'agit pas seulement de faire plus, mais également mieux, avec une logique partenariale et des priorités thématiques et géographiques de notre politique de développement. Et donc ces moyens en hausse seront consacrés en priorité à l'éducation, la sécurité alimentaire, la nutrition et la stabilisation des zones de crise. Nous devons également apporter des solutions concrètes qui nous permettent de nous attaquer à plusieurs crises à la fois. Et les programmes d'alimentation scolaire constituent un modèle de ce point de vue-là. En effet, un programme d'alimentation scolaire, ce n'est pas seulement de la nourriture, mais c'est une solution porteuse de plusieurs bénéfices considérables qui présentent un fort retour sur investissement. Pour les enfants, c'est aussi un moyen de lutte contre la faim et la pauvreté, un moyen d'améliorer la nutrition, la santé, la qualité des apprentissages et aussi, bien sûr, de renforcer l'égalité de genre. D'autre part, ces programmes apportent un soutien au marché, aux agriculteurs, aux systèmes alimentaires locaux et donc à l'économie en général. On estime ainsi que lorsque 100 000 enfants supplémentaires bénéficient d'un programme d'alimentation scolaire, 1700 emplois sont créés. En France, les cantines scolaires font partie de notre patrimoine. Dans notre système éducatif républicain, l'accès aux repas scolaires à moindre coût fait partie de notre politique éducative, car un enfant n'apprend bien que le ventre plein. C'est pourquoi le président de la République française, Emmanuel Macron, a souhaité s'engager personnellement en faveur de la coalition mondiale pour l'alimentation scolaire initiée par le PAM, qu'il a lancé l'an dernier aux côtés d'autres partenaires venus du monde entier. La France s'est beaucoup impliquée pour porter la mobilisation politique en faveur de la coalition, aux côtés de la Finlande, de l'Union africaine et du PAM. Nous l'avons fait par exemple à l'occasion du sommet sur les systèmes alimentaires à New York en septembre, lors du sommet du G20 à Rome en octobre, qui a reconnu dans sa déclaration finale l'importance de la coalition, ou encore lors de la réunion mondiale sur l'éducation qui s'est tenue à l'UNESCO en novembre dernier. Nous poursuivons ces efforts dans le cadre de la présidence française du Conseil de l'Union européenne, comme cela a été le cas lors du sommet UE-UA et comme c'est le cas aujourd'hui. Nous souhaitons que l'alimentation scolaire trouve toute sa place lors du sommet du secrétaire général des Nations Unies sur la transformation de l'éducation qui se tiendra à New York en septembre. Derrière cette mobilisation politique, nous mettons aussi une expertise à disposition du PAM à Rome. Les instituts de recherche français sont aussi mobilisés et contribuent aux travaux du consortium international de recherche. Les bonnes pratiques d'alimentation scolaire en France seront également partagées avec tous, y compris dans leur dimension sociale. Et au titre de notre dispositif d'aide alimentaire, nous continuerons de financer des programmes d'alimentation scolaire dans les pays touchés par les crises et les conflits, comme nous l'avons fait par exemple en 2021 en Afghanistan, en Algérie, en Éthiopie, à Haïti, au Niger, en République démocratique du Congo, au Tchad ou au Venezuela. À la suite de la prise de Kaboul, par exemple, nous avons apporté une contribution de 13 millions d'euros pour un projet du PAM en Afghanistan. Nous avons aussi soutenu la coalition par un soutien financier au secrétariat que nous poursuivrons en 2022. En conclusion, vous le voyez, la France est pleinement engagée pour permettre l'accès à l'éducation de tous les enfants, y compris dans des contextes de crise et de fragilité, et pour promouvoir le déploiement de l'alimentation scolaire. Nous soutenons le travail effectué dans de nombreux pays pour mettre en place des programmes nationaux pour soutenir les plus vulnérables. À cet égard, nous encourageons les pays éligibles à inclure les programmes d'alimentation scolaire dans leur demande de subvention pour le partenariat mondial pour l'éducation. Je voudrais enfin remercier l'ensemble des acteurs, des pays membres, des partenaires engagés dans la coalition pour l'alimentation scolaire. Le succès de cette coalition repose sur une mobilisation massive dans la durée. Je vous remercie.
Thank you so much, Madame Ambassador, for those remarks and for the commitment of your president personally to the School Meals Coalition. Thank you so much. Now we will try again with the video remarks from Minister Skinner from Finland. Please, technical team, play the video. It seems that we're still having some technical difficulties, so apologies for that. That gives us a little more time to talk to our esteemed panelists. So let's move straight into the roundtable. It really is an honor for me to bring together these great panelists from across the world. As you know, the world is still recovering from a global emergency. 1.6 billion children around the world were impacted by school closures because of COVID-19, conflicts, and humanitarian crises. These together, added up, is what the UN Secretary General calls a generational catastrophe. A generational catastrophe. That is serious. What are we doing? What can we do? It's really an honor to bring together panelists who are working together across the globe to talk to us about how we can ensure children don't miss out on the important education, nutrition, and health services during crisis and conflict. So it's really an honor to present our distinguished panelists for today. We have His Excellency, Mr. Tariq Salem Al Akbari, Minister of Education from Yemen. We have Ms. Yasmin Sharif, CEO of Education Cannot Wait. Ms. Vilma Tyler, Senior Advisor of Nutrition from UNICEF, and also Mr. Daniel Wangaga, Senior Director, Technical Resources of the Global Disaster Management Team from World Vision. Thank you so much to all the panelists for being with us today. Let me start with Minister Al Akbari. Minister Akbari, at the Nutrition for Growth Summit last year, Yemen provided a strong statement on the importance of scaling up school health and nutrition to improve children's education and break the cycle of poverty. Can you tell us, why are school meals important in humanitarian crises, and what measures the government of Yemen envisions to take to improve school health and nutrition coverage? Over to you, Minister.
أهلا وسهلا، حياكم الله. سعيد جدا بمثل هذا اللقاء وهذا الاجتماع، وأحيي السيدة كارولين الجريس وأحيي المجتمعين جميعا في مثل هذا اللقاء الهام الذي نتدارس فيه الوضع التغذية والصحة المدرسية والتلاميذ والمعاناة التي يعانوا منها. في بلد اليمن كما تعلمون هناك حرب طاحنة تخاض ومعركة ضد المؤسسات الدولة بعد انقلاب ميليشيات الحوثي على الدولة ومؤسساتها. هذه المعركة أثرت تأثيرا سلبيا كبيرا على الطلاب والتلاميذ وعلى مختلف القطاعات التعليمية في البلد. حرصنا كل الحرص نحن في حكومة الجمهورية اليمنية على أن نحافظ على مستوى معين من التحصيل العلمي والتغذية المدرسية، وأن يحافظ الطلاب على حضورهم وانضباطهم داخل الصف الدراسي، ومشروع التغذية المدرسية والمحافظة على صحة التلميذ في إطار الصحة المدرسية هي أحد أهم أولويات الوزارة في الفترة الماضية وفي الفترات القادمة. وإحنا لدينا أن التلاميذ يحتاجون أيضا إلى نظام غذائي من أجل النمو والتطور وبناء أجسامهم والقدرة على تحمل الحصص الدراسية والذهاب إلى المدرسة. ما أدري الصوت أحد يسمع صوت يصل الصوت؟ فالحرص على أن الطلاب يذهبوا المدرسة، لأن آثار الحرب الكارثية هي أثرت بشكل عام. لدينا مئات المدارس المدمرة، لدينا العدد الكبير من الأسر المشردة لا يحصل تلاميذها على تغذية كافية ولا يحصل على وجبات كافية للذهاب إلى صفوف الدراسة. أيضا هناك البرامج والسياسات المتماسكة لتحقيق حقوق الإنسان للأطفال حاولنا نرسمها لتواكب الاحتياجات الضرورية للعملية التعليمية والتربوية، وكيف أن نخلق بيئة تعليمية يستطيع الطالب من خلالها التحصيل العلمي وتطوير مهاراته وقدراته. حجم المعاناة كبير، وحجم الأرقام مهولة ومخيفة، وحجم الأرقام والكوارث والآثار النفسية والصحية والغذائية والتعليمية وفي البنية التحتية للتربية والتعليم كبيرة جدا. لدينا مئات المدارس المدمرة، لدينا مدن مقطعة، لدينا التلاميذ لا نستطيع أن نصل لهم الغذاء. في برنامج الغذاء أيضا العالمي نشكرهم على جهودهم التي بذلوها والتي قدموها لدعم تلاميذ اليمن، حيث يتلقى نحن حوالي 2 مليون فاصل 2 طفل في المدارس وجبات. نحتاج أن نطورها في الفترة القادمة وأن ننوعها بحيث يتلقى الطالب الغذاء الكافي من مختلف الفيتامينات والبروتينات ليغذى جسمه ليستطيع أن يقاوم البيئة الحرب الصعبة والكارثية في الفترة القادمة. أيضا يتم هذا التوزيع عبر وحدة تنفيذية لهذه البرامج وعبر مجموعة من المرشدين والمساعدين والمنفذين والمشرفين. نحن حرصنا أيضا على أننا نستفيد من هذا في الفترات القادمة ونطوره للتعاون مع المزارعين أيضا المحليين في الحصول على القمح والحبوب وبعض الفواكه والخضار التي نستطيع من خلالها أن نوفر أيضا وجبات أكثر قدرة على أن تعطي الطالب طاقة أكبر على تحمل المصاعب في فترات الحرب. فهنا ولذلك أحيي هذه الجهود وأحيي جهود الغذاء العالمي وأحيي جهود الأمم المتحدة ومختلف الجهود التي تساهم وتدعم اليمن في مثل هذه الظروف الصعبة. نحن حقيقة بحاجة أن نعمل كشركاء في هذه الظروف ونحاول أن نتعاضد وأن نكمل كل الجهود ونستكملها في إطار تعاوني يحقق الهدف الأساسي للمحور الأساسي وهو التلميذ، وكيف نصل لهذا التلميذ وكيف نستطيع أن نبقيه في صفوف الدراسة ولا يغادرها بحثا عن لقمة العيش. فكثير من الطلاب غادروا صفوف الدراسة بحثا عن لقمة العيش لمساعدة أهاليهم أو أن أهاليهم لا يستطيعون أن يوفروا لهم وجبة غذاء. هذه الجهود وعملنا نحن أيضا على تطوير على تطوير شيء خلاص فالجهود التي حققت في الفترة القادمة سنطورها وسنعمل على تطويرها بالتعاون مع جميع الشركاء. ولا زلت وأكرر تحياتي لجميع الحاضرين والمشاركين، وأننا إن شاء الله في الفترة القادمة يكون لنا تواصل أكبر وأوسع بحيث نحقق هذا الاستقرار للعملية التعليمية والتربوية. شكرا.
Thank you so much, Minister Al-Akbari, for those important remarks and for your commitment and leadership in scaling school health and nutrition. I think that we will try one last time with the video from the Minister of Development Cooperation from Finland.
Excellencies, dear colleagues, ladies and gentlemen, it is a great pleasure for me to welcome you to today's event at the European Humanitarian Forum. We have an important discussion ahead. How can we integrate school health and nutrition better into education in emergencies? Natural and human-made disasters and crises are often related to high degrees of food insecurity, malnutrition, and loss of access to education. Conflicts threaten the future of children and human capital of entire nations. A sad current example of this is, of course, the situation in Ukraine. The consequences of the current war on Ukraine's children are deeply worrying. We do not yet know how long the war will last, but with the massive humanitarian needs and displacement it has caused, the war has already had a devastating effect on a large share of Ukrainian children. I'm very proud that the international community has reacted so quickly and committed significant support for Ukraine, including humanitarian aid going directly for children. Effective assistance in the form of school meals and other school-based interventions can be particularly important for those children whose nutrition, education, and health are deeply affected by crises. Conflict settings also increase the risk of child labor and gender-related threats. Promotion of school attendance and school meals can be a protective factor from these risks. They can also counter the negative consequences of crises on health, nutrition, and education. By keeping up education, countries can support their recovery from crises, and I'm talking from experience. Finland introduced free of charge school meals in the 1940s when we were in the middle of a devastating war. Later on, it was also a measure to address post-war poverty and malnutrition. Back then, Finland was a poor country, mainly relying on agriculture, and 40% of all 15-year-olds were illiterate. School attendance rates were low. Today, every child in Finland from pre-primary to upper secondary school is entitled to a free daily meal in school. After over 70 years of school meals, Finland has developed from a poor rural country to a modern welfare state and is standing out as having one of the best education systems in the world. Today, we are recovering from another global emergency, the COVID pandemic. At the peak of the crisis, 1.6 billion children around the world were impacted by school closures, while 370 million children missed their main meal at school. When looking for practical solutions, we believe that school meal programs, when supported by other complementary interventions, deserve to be highlighted as game-changing initiatives to break the cycle of humanitarian crises. To make it clear, simply put, nutritious food provided in the school is among the best investments for the future. Evidence demonstrates that school meals produce high returns in education results, gender equality, health, social protection, and economic and agricultural development. And that is why Finland, in close collaboration with member states from north to south, have been intensively working on building a global school meals coalition, which was launched at the UN Food Systems Summit last September. The School Meals Coalition currently has 61 governments as members, and all coalition members have one thing in common. We do recognize that school meals programs are about so much more than simply giving a child a healthy meal. I hope the discussion today can strengthen our resolve to work together and expand this program across all countries in the world. Let's find ways together so that governments, local entities, municipalities, universities, the private sector, and civil society could all play a part in delivering school meals programs to those most in need. I wish you an excellent event. Thank you so much for your attention.
And thank you to Minister Skinari for those remarks and really setting the scene for how important partnerships are when moving forward. So I will move over to our next speaker. Let me move to our next speaker, who is Ms. Yasmin Sharif. She is the CEO of Education Cannot Wait. Ms. Sharif, my question to you is, ECW works to position education as a priority on the humanitarian agenda. School health and nutrition is part of ECW's approach to ensuring children are ready to learn. Can you tell us how a more collaborative approach among actors on the ground could really support these objectives.
Thank you very much. Merci beaucoup. Thank you, and thank you to the Ambassador of France and Minister Skinnari, and also our colleagues from elsewhere in the world, and the Minister of Education as well. Let me say this: it's very important to know from the outset, Education Cannot Wait is a global fund for education in emergencies and protracted crises. And we are based within the United Nations system. And the reason I mention that is because Education Cannot Wait does not implement programs. This is done by WFP, UNICEF, Save the Children, but we are a partnership builder. And since the question is about partnership, I wanted to start with that entry point. We ensure that everyone works in one partnership, one joint program, where we provide education through a holistic, child-centered approach. And when I say holistic, it means that school feeding is one of the key components within those programs. So instead of having many different interventions, is one program facilitated by Education Cannot Wait. We put in the funding, and then everyone works together when there's a crisis within the same program. They make assessments together and so forth. And so I think that's important because it's all there to stimulate partnerships rather than working in silos, or someone does school feeding there, someone else provides rehabilitation of the school there, a third of psychosocial services and mental health there. No, it's all within one program. And one of our key partners is WFP, the World Food Program, when it comes to school feeding. Because for all the work that we invest in as a global fund, it's impossible for a child or a young person, an adolescent, who lives through a conflict or a crisis, such as Syria, Lebanon as a refugee. Now we look at Ukraine, where Education Cannot Wait just made an emergency investment of $5 million. Or Afghanistan, where we visited, I was there just a few months ago, where we invest in girls' education in particular, or the Rohingya refugees. One cannot implement education unless every one of these children, and here we speak 128 million children in crisis-affected countries or living as refugees as a result of conflict, climate-induced disaster, or forced displacement. There are 128 today because of COVID. It's gone up from 75 million to 128. One cannot deliver education unless you also address their nutrition and their ability to focus in school, to have one school meal a day. That's why it's so important, our collaboration with the World Food Program. Now, in most of these countries, we are speaking about extreme poverty. Besides that there is a war, they are fleeing. Now, when you are extremely poor, as a parent, you cannot feed your children. I mean, we have heard stories from Afghanistan through the international media where families had to sell their babies in order to feed their family. We're speaking about extreme hunger in these countries. So every investment that Education Cannot Wait, we work closely with actors who can ensure that there is at least one school meal embedded in our joint program. And often that is World Food Program. They're doing a fantastic job, besides getting the Nobel Peace Prize just a year or two ago, and have become an extremely great partner of Education Cannot Wait and all the other agencies and NGOs, civil society with whom we work. And we also know from a trauma perspective or concentration perspective that if children cannot eat, they cannot focus, they cannot learn, there are no learning outcomes. We also know that when parents are reluctant to send their children to school because they want them to go and work in the fields or beg for money, if they're offered a school meal, that creates an incentive for a very extremely poor family to actually send their girl or their boy to school, knowing that they're going to be fed at school. So school feeding serves many purposes, and we see that in our work in conflict and crisis countries. It enables children and youth from extremely poor families, which they all are when you suffer a conflict or a war, to actually access and the right to food and to eat at least one meal a day. It allows parents, it becomes an incentive for parents to send their children to school, not at least girls, knowing they will get a meal a day. And thirdly, it greatly enhances their possibilities to actually achieve learning outcomes. Again, you cannot learn anything on a hungry stomach, let alone go to school. So for us, this is a critical, important component of the work that Education Cannot Wait invests in. And again, to conclude, we do this by bringing everyone together in one program, joint partnership, new way of working, and school feeding is often at the center of it. So thank you very much.
Thank you so much, Yasmin, for those very powerful comments, really setting the scene well. Next, I'm going to hand over to Ms. Vilma Tyler from UNICEF. My question to you, Ms. Tyler, is UNICEF is leading several strands of work that deliver integrated packages to children living in humanitarian crisis settings. Can you tell us why these integrated programs are game-changing solutions and provide some examples of successful partnerships that foster children's education and nutrition in emergencies? Over to you, Ms. Tyler.
Thank you, Ms. Legros, and esteemed guests. I'm delighted to be part of this roundtable and to engage in this important dialogue, where I will share UNICEF's efforts to deliver integrated packages of services for children affected by humanitarian crises. We're all aware of the ripple effects of the COVID-19 pandemic. We're still, going through it. The accompanying lockdown measures in many countries have severely impacted children. It has impacted their access to nutrition, immunization services, screening for malnutrition has dropped, child protection risks increased as schools closed down. Additionally, these school closures have deprived children of meaningful learning and important social safety nets. Overall, households were placed under significant stress, with children being the most vulnerable to toxic stress. I'd like to share with you some statistics from a study that was conducted by UNICEF's Office of Research in Ocenti, where they looked at the impact of school closures on children's nutrition. The paper was titled "Missing More Than a Classroom." Since the start of the pandemic, 370 million children have missed out on meals and essential health and nutrition services. 39 billion meals were missed during school closures. The emerging data confirms the increased risk to the most marginalized, particularly girls. We're expecting to see more impacts. 24 million additional students may drop out of school. There's 100% increase in anxiety and depression symptoms in children. 10 million more girls are at risk of early marriage between 2020 and 2030. And 9 million additional children are at risk of child labor by the end of 2022. These are significant numbers to reflect on. At UNICEF, our goal is to leverage our multidisciplinary expertise to deliver support to children in a holistic and integrated way. One of these solutions is to use schools as platforms for integrated service provision. In this approach, we are able to meet the holistic needs of children related to health and psychosocial support, nutrition, protection, learning, life skills, and water and sanitation and hygiene. Ensuring integrated services through schools and other education facilities is a game changer because Better child health, including mental health and nutrition, contribute to their overall development and well-being and protect children against disease. It eliminates barriers to children's education, especially for girls. It helps children stay in school where they are protected and supported. And school health and nutrition programs provide essential safeguards and can make an important contribution to a sense of normalcy for children and their families. However, as other colleagues have said, integrated services require coordination among partners from across sectors. That is why UNICEF works closely with partners and leverages a cross-sectoral approach to deliver innovative school health and nutrition programming. In the context of the COVID-19 pandemic, UNICEF worked to deliver a range of services to accelerate learning recovery for all children. I'll give you several examples from a number of countries where we have done this. For example, in Guinea, promotion of health and WASH measures in schools positively contributed to limiting the spread of the Ebola virus and the new variants of COVID-19, both in schools and in communities. The rehabilitation of school infrastructure was a priority for limiting the spread of the outbreaks. UNICEF supported the renovation of education facilities, the construction and the repair of water points, coupled with back-to-school campaign and the provision of sanitary kits to limit the spread of these viruses. Formal and non-formal education programs offer critical entry points to improve the mental health and well-being of children, adolescents, caregivers, and teachers who have experienced the psychosocial impacts of emergencies. For example, in Azerbaijan, UNICEF, in cooperation with the Ministry of Education, implemented an initiative on school-based mental health and psychosocial support in conflict-affected regions. The intervention focused on building teachers' capacity to deliver socio-emotional support, supplemented by other school-based health and protection services. In the state of Palestine, as well as in the Rohingya camps of Cox's Bazar, UNICEF collaborated with the government and other partners to provide integrated services and help facilities meet minimum child-friendly standards. This included WASH services, immunization, hygiene, and menstrual health, and partnering with others like WFP to provide feeding through schools. In the state of Palestine specifically, our country teams have been able to support the rollout of nutrition-friendly school services and framed a policy for the prevention of anemia. And my last example is from Afghanistan, where during COVID, nutrition services such as iron and folic acid supplements were provided to adolescent girls through the community health workers because of the school closures, and are continuing to do so to this day. These examples demonstrate that schools are, as integrated service platforms, play a very critical role in ensuring the development, well-being, and learning of children during crises. The COVID-19 pandemic has provided a renewed opportunity to reimagine the way that schools can serve these holistic needs of children in emergencies. Therefore, we need to seize this opportunity to continue forging partnerships across sectors. We must do so in ways that restore and entrench robust school health and nutrition that help build the resiliency of education and social protection systems. Therefore, the focus on learning recovery must be twinned with building more resilient systems that deliver a range of protection, health, nutrition, and psychosocial services. Thank you.
Thank you very much, Ms. Tyler, for those very clear examples. My last speaker today is Mr. Daniel Wangaga, who's the Senior Director from World Vision. Mr. Wangaga, my question to you today is, World Vision has a long history of work on the ground to protect and support children in many countries, including working in emergency contexts. Can you share with us some of the experiences of supporting school health and nutrition programs and how they supported access to education and learning? Over to you, Mr. Wangaga.
Thank you. Thank you very much, Madam Chair and my fellow guests on this call. So I would like to start by saying, indeed, World Vision has had a long history of protecting and supporting children in many countries. And provision of school meals is one of the key interventions that we believe provide safety, facilitates learning and well-being of school-going children, and especially girls during a crisis. Currently, World Vision is delivering school meals in about 8 countries around the world, working in partnerships with the governments, the World Food Programme, UNICEF, local governments, and communities. Some of these countries include the DRC, South Sudan, Burundi, Mali, Venezuela, Mozambique, among others. In 2021, World Vision was able to reach a total of 670,000 children, 69% of these being in the most fragile context where we work. As someone who received school meals in my childhood, I know firsthand the transformation that school meals can spur in a child's life. I've witnessed many successful school meals programs, and the common thread that cuts across all of them is the importance of partnership. And I think this echoes what Madam has said. So we need to partner well with the governments, with other organizations, with other agencies, with the parents, with the local farmers, and so on. And so to answer specifically to the question, I want to share with you a few experiences that we have witnessed in the field. And I want to start with Mozambique. We have a school feeding program in Mozambique that has run for a while in the Nampula project. And this program aims to address the low levels of human capital in that region by providing school meals to support education and nutrition among school-going children. A 2022 evaluation of this program reports a 42% increase in school enrollment, thereby improving the well-being and the predisposition to learn for the children. Secondly, in South Sudan, we are working with WFP on a school meals program that covers a total of 173,000 children and also teachers. And the program covers a number of objectives built around the school, and these include 1, cooking demonstrations to parents and schools on how to best prepare meals with a high nutritional value. 2, training and introduction of energy-saving stoves to minimize environmental degradation. And this program brings other partners on board, like UNICEF, FAO, the government ministries of agriculture, gender and social welfare, Ministry of Education, and we use the schools as a platform to achieve a number of objectives. And 3, working closely with the Ministry of Health in South Sudan, we're using schools as a place to bring health interventions to school-going children, which includes deworming and vitamin A supplementation. And 4, establishment of school nutritional gardens within the schools that provide vegetables and other condiments to improve the quality of the school meals provided, but also help the children learn about the importance of growing their own food items at home. And 5, we have also incorporated some training to the school children and communities within a school catchment area on various aspects of disaster risk reduction. Then my final example that I want to share is on Venezuela, where provision of a school meals program to about 30,000 people has proved to be one of the ways that we can complement the state's response in reaching the most vulnerable by introducing take-home rations. This program has been essential in getting children back to school and also ensuring that they have food to eat in the midst of the current economic crisis. And so from these examples, we can see that school meals can address a number of sectors and a number of needs, includes child protection and safety, environmental issues, DRR, health, nutrition, wash, livelihoods, and so on. And in conclusion, I would like to say that a healthy free meal served at school is oftentimes the only meal a child will get that day. And I cannot overstate the importance of this initiative in ensuring that children can learn on a full stomach and be protected no matter where they live. We must come together to continue the scale up of school meals program, to build back better from the COVID catastrophe, to get more children back to school, and to ensure access to better education, better health, better nutrition to these children with their minds powered by a plate of nutritious food served daily at school. Thank you.
Well, thank you so much, Mr. Wangago, for those powerful remarks. Definitely couldn't agree with you more, and really showing some very concrete examples of, as you said, partnerships and practice on the ground. Well, we're almost at time, so I wanted to begin by thanking very much our distinguished panelists today. Sincere thanks to Minister Skinnari, Minister Al-Akbari, Ambassador Jorgensen, Mr. Wangaga, Ms. Tyler, and Ms. Sharif. Your insights, your expertise have been so valuable. We really are delighted to have such great support from partners like yourselves. But as the global community faces one crisis after another, there has never been a more important time to promote and invest in programs that we know are effective. And you've told us about that here today. But despite the progress that we've heard, there's still a long way to go. And there are some glaring inequalities. Right now, about 80% of children in high-income countries receive school meals, while only 20% of children in low-income countries have access to the same services. Specifically, there are 73 million children around the world that are living in extreme poverty and crisis-affected countries who are not reached with daily school meals, even before the pandemic. So the European Humanitarian Forum is really a golden opportunity to put together a partnership between countries and stakeholders to support the scaling up of integrated school health and nutrition approaches that will benefit generations of children for decades to come in both the humanitarian and development contexts. So thanks once again to all the panelists for being with us in this important discussion. And thank you all to the participants for participating in today's event. Thank you.